Hope everyone is keeping safe during this period. These challenging times remind me of a quote from Confucius. Our greatest glory is not in never falling, but in rising every time we fall. My name is Mitesh Kumar. I am the current chapter director for IEQ Singapore. The topic of today's seminar is indoor environmental quality in the COVID-19 age. Today's speaker is Mr. Donald Weeks. He has about 45 years of comprehensive consultation expertise and project experience in implementation and management of inspection for hazardous material. As a certified industrial hygienist and a certified safety professional, Mr. Weeks has served as an environmental health and safety professional for various international corporations. He is the current president for IEQ GA. He is the board of director for IEQA Canada. He is the chair for ASHRAE IEQ position document team and ASHRAE IEQ guide committee member as well. So without further delay, I will now hand over the presentation to Mr. Donald Weeks.
So today I'm going to discuss a number of topics with regards to my field of expertise, which as a certified industrial hygienist, I've been dealing with for as mentioned, 45 years. So I'll be talking about, what is industrial hygiene and what does it mean to do industrial hygiene inspections? What is indoor air quality? Again, what do we do in terms of the type of buildings and inspections that we conduct there? And then a relatively newer term, what is indoor environmental quality, which is the area of expertise that is growing rapidly in the last couple of years. I'm also going to present a number of case studies as well, so to illustrate each of these principles. So let's start with industrial hygiene first. Okay, industrial hygiene has been defined as the science and art devoted to the anticipation, recognition, and evaluation and control of environmental factors and stressors arising from or in the workplace. And then what these factors can do is, of course, cause sickness, impaired health, impaired well-being, and significant discomfort among workers and among the citizens of the community. So this definition has been developed by a number of organizations, but specifically the American Industrial Hygiene Association. It's changed over the years to some extent. The one I always emphasize with this is, yes, we all are scientists and we all are working very hard to keep our science up to date. And that makes it important that we also pay attention to the art of industrial hygiene. And what does that mean? Well, the art of industrial hygiene is taking the science and then basically applying it to the situations that you find yourself in and that you're working for in terms of your client, in terms of the employees of the facility. So it's not just taking the science and looking at the number of what you have on your meter. It's also interpreting that information and applying it directly to the workplace in which you are doing your evaluation. You also note that we're now talking beyond just occupational disease, which has been the focus of industrial hygiene since its beginnings in the early 1900s. We're also looking at impaired well-being and significant discomfort. So we do have measurements that we use, obviously, to determine what's going on in a facility, but we're also looking at what can cause significant discomfort and impaired well-being without necessarily causing an occupational disease. So industrial hygiene has expanded its capabilities in that regard. I wanted to give one example of one group that has been involved with this, and this is a group, Workplaces Without Borders. And they are looking at underserved work populations, and you can see many of them are in small workshops or unregulated factories, but it's also on streets and open spaces, so that you have a number of individuals that may be exposed to things as they're doing their job and are not necessarily protected by the regulations that we have established for in occupational health. This group has been involved with this for approximately 10 years. Workplace Without Borders is operating in, I believe, 30 different countries. But it is an example of how industrial hygiene has gone beyond the typical workplace, and it's now looking at things in the fields, pastures, and forests, at home, all different types of jobs that people are doing. And of course, in this COVID-19 era, not only are the individuals that are dealing with these types of situations exposed to different types of chemicals and different types of exposures, but many of those who are office workers are also now back home working out of their homes and are also exposed to things that aren't necessarily typical in an office building. So, for example, I'm in my spare bedroom right now talking to you, and it's considerably warmer here than it would be if I was in my office, and that's a thermal discomfort. And I believe there's a lot of those types of situations going on. If you participate in enough Zoom meetings, you can see where people have modified their house in order to accommodate what they're doing. And now, how do we regulate, how do we prevent people from becoming ill from what they do there? So it's a number of different ways in which we can do that, and we'll talk more about that. And here's an instructor, Tan Nguyen. He's a Workplace Without Borders trainer, and he's leading discussion to students on Vietnamese factory. And so this is one of the areas in which Workplace Health Without Borders is working very efficiently in terms of helping out people that are not necessarily typical of the type of individuals that we serve as industrial hygienists. Let's look now at indoor air quality. This is a field that really started in the late 70s and early 80s in places where there was an oil embargo. Many of us who are of a certain age remember the embargoes that took place in 1973 and then again in 1979, where there was a shortage of oil in the sense that we in Western countries were not getting the oil that we had expected from other countries. So what happened was people did things to their workplace to reduce the amount of energy expense that they had. So, and this led to increased complaints about the quality in office buildings and in other facilities as well. So defining indoor air quality is the air quality within and around buildings and structures, and it's known to affect the health, comfort, and well-being of building occupants. So you can see that this is not specifically around problems with regards to environmental stressors. This has to deal with the discomfort and health and well-being of building occupants. So we're doing measurements in this particular case for temperature, humidity, in some cases carbon dioxide, total particulates, total volatile organic compound, and other measurements that we think are important to determine what's going on in a building that is where there are reports and complaints about problems with the air quality in the building. We're also looking at ventilation systems. We're looking at outdoor sources of problems. This has been a field that's been developing for approximately 40 years. And many of the people that are probably on today's webinar are people who are doing this type of inspections. And that's good. That's a good starting point. But we'll talk a little bit more what the limitations might be in terms of indoor air quality when we get into an indoor environmental quality, which we'll be talking about in a little bit. But this is an area that I've been working with for over the last 40 years. And it's, as I said, it has been evolving, and I think it will continue to evolve as we go forward. And I wanted to give a little plug to our sponsor, this Mitesh Kamer, and he's talking about, for example, this was a presentation that was given on July 8th, promoting a COVID-safe workplace with local international guidelines and standards. And he's one of our active chapter heads in IEQA, and I think that this particular presentation was set up by himself, and I appreciate that. And we have chapters of IEQA throughout the world, and not only in Singapore, but in India, Australia, throughout the United States, and Canada, and in Panama. So it is an international organization and represents what we're doing right now in terms of the indoor air quality issue. So what's indoor environmental quality? This is a relatively newer term that has been evolving over the last 10, 15 years. And why did it start up? Well, it started up mainly because indoor air quality measurements, in many cases, were not detecting the type of, or not really figuring out what type of problems were really existing in a building. We did our measurements, and most of the cases, the measurements showed that everything seemed to be operating in the way in which it was supposed to operate. Well, unfortunately, that wasn't necessarily the feeling of the building occupant, and they would question us and ask us, well, why do we still have problems? You're saying everything is in good shape, yet we're still suffering here. We still have discomfort. We still have problems with people calling in sick. We still have problems with people who enter in on Monday mornings and become ill before the Monday afternoon. So what's the problem here? Some of us who are working in the indoor air quality field began to say, that we needed to do more than just the standard measurements that we had been doing, which I outlined before. And so we have to take into account many other factors, including lighting, noise, yes, air quality as well, but also damp conditions, vibrations, a whole variety of different items that are not necessarily typical of what we want to measure. But again, we're looking to see how the building's environment is in relationship to the health and well-being of those who are occupying it. So this could also go beyond just a typical office building. We're also now talking about retail stores, malls, schools, even homes in many cases. So indoor environmental quality has a broader connotation than indoor air quality. And therefore, we're looking at different factors that may be involved with that. And one of the ones that we talked briefly about before is thermal discomfort. You have many individuals that are working in facilities that are trying to save energy, and one of the best ways to do that, of course, is to cut back on the amount of air conditioning or even the ventilation that you have in the space. And that, of course, can lead to problems from the viewpoint of discomfort, not to the well-being of the individuals that are working in that place. So this is a newer area, as I said, within the last 10, 15 years. One of the organizations that I'm involved with, the Indoor Environmental Quality Global Alliance, IEQ, is addressing these problems. And you can see by the logo, we're looking at lighting, noise, acoustics, ventilation, also temperature discomfort, things of that nature that are different than what we normally have been doing, but we're including indoor air quality as well in that area. And this organization is less than a year old in terms of its incorporation in Belgium last November. And we already have different types of organizations that have been involved. This is an organization of organizations. So we have a number of different members throughout the world, including ASHRAE, American Industrial Hygiene Association, American Conference of Governmental Industrial Hygienists, ISHRAE in India, AICAR in Italy. We're looking at REFCA also in Europe. We're starting to get inquiries from places such as South America and other places as well. So we're looking to expand this rapidly and become a force. One of the things I'm proudest about in terms of what we've done so far, and as I said, we're a very young organization, is that very early on in late March, this organization published a position document, talked about the possibility and the potential of airborne transmission of COVID-19. This is one of the early publications of that. There were a number of scientists that were talking about this, but we're having difficulty actually getting their data published. The IEQ put it on its webpage that they supported this proposition and this possibility. And again, I think that's a good indication that this organization is going to be very active going forward. So let's look at a couple of case studies here that over my last 45 years I've been dealing with. This is the sewage treatment plant. It's industrial hygiene because basically this is a potential problem for the health of the individuals who work at the sewage treatment plant. Not to go into a great deal of details about the plant other than to say this was a facility that was serving a suburban area in the United States. It had been recently renovated and they had put in some kind of odor control, what was called by the engineering firm as triple oxidation. The reason they were doing that was that this was in an area of the town that was relatively well populated. It was near the town hall. They were concerned about noxious odors that might be wafting from the various parts of the facility, including where they're doing concentration of the actual waste into what would be called patties, or remove most of the water from it, and then you would have left over just the waste itself. Well, the way they came up with this is they came up with the triple oxidation material. They never mentioned in this document that this was ozone. They just called it triple oxidation, and as you can see, ozone is O3, and it took a number of meetings before they would admit that yes, what they're using to control the odors was ozone free. And the plant personnel were obviously not feeling very well, sore throats, chest pain, coughing. So we had to basically go in there and measure what was happening. And this was a typical industrial hygiene type of exposure. We did do the air sampling in the area in which they were doing their compressing. We found, as would be expected, that elevated levels of ozone were present in the plant. Now, the workers themselves knew that there was something wrong and obviously were feeling the effects of it. They just didn't know what was wrong, and they weren't getting good information from the manufacturer. It took a while for us to get involved with this particular case, but we did get new technology in there, and this is going back about 15 years. There's better technology than ozone to control odors. Ozone does a great job in controlling odors, and in certain circumstances, it is necessary, and it is, in many cases, the choice, the best choice. But it is not the best choice necessarily when you have employees that are going to be exposed to the ozone in the plant itself. So we did work with the sewage treatment agency in that town, and we got newer type of devices that were able to do this without necessarily adding to the problems to the workers. Now, indoor air quality, a different type of problem. This one is a large governmental building complex, one of the largest in, as you guessed by the flags, in Canada. It houses probably close to 10,000 governmental employees in the overall complex, which consists of 6 different towers. It's a big building without what I would call anything to recommend it as being a place you would want to work. It's about the only thing that really recommends it is that it's convenient on transport. But once you're in the building, there's very little in the way of lighting. That outside lighting. There's a lot of, particularly in the wintertime, it can get very bad air, as people would call it. And then people were periodically complaining about this odor, about these problems that were happening in this building, and they hired a number of different consultants to come in and take a look at what was going on. And of course, what they would do in most cases is they would focus in with what they were planning, they were taking in the way of tests. Not to criticize my fellow consultants, but you really need to have a good plan, a strategy, a air sampling plan in advance to know what it is that you're looking for. Because if you just take the typical indoor air quality parameters, carbon dioxide, carbon monoxide, temperature, humidity, total volatile organics, total particulates, maybe formaldehyde or something of that nature. In many cases, depending on where you took the test, you're not going to have any adverse findings. Well, that doesn't really help the people who have adverse health effects, such as coughing and choking and just complaints about bad air. And this particular building ended up frequently getting coverage on the local media as to what the problem was with this particular building. And it, again, like I said, is very large, very prominent building. You want to make sure that you get the right information so that you can do the right thing. We came in, my consulting company and I, and we looked at the building from top to bottom at first, did a thorough visual inspection to determine exactly where the problems may exist and what was happening in these buildings. We focused in on 2 items: carbon dioxide, which would be an indication of problems with regards to the amount of ventilation that you may have in an area, and volatile organic compounds, or VOCs. And the reason that we concentrated on VOCs is that we noticed that in many places there was issues with regards to various types of storage problems in this building. Storage of in some cases, chemicals, minor amounts, but enough to cause problems, and the use of chemicals throughout the building for cleaning. One of the offshoots of constant complaints was that they were doing lots more cleaning of these buildings, but they weren't necessarily using good techniques in terms of removing volatile organics that may be evolving while they're doing the cleaning. We took carbon dioxide temperatures or carbon dioxide measurements in the afternoon. So one of the other tendencies that people have to do is to fit the sampling into their schedule. So for example, previous consultants would do early morning sampling because that was before most people arrived, and therefore they wouldn't necessarily have to interact with people who are working in this building, people who are occupying these buildings. Well, that's not necessarily going to give you the highest concentration of carbon dioxide. Carbon dioxide being something that exhausted or is expelled by people who are in the building. So you're going to have higher levels in the afternoon when people have been in the building for a number of hours. And these are one of those buildings where you would stay in the building throughout the entire day. You didn't necessarily walk outside. And that is particularly true in the wintertime when the average temperature outside was minus 20. So you didn't necessarily have people who were going to, able to get fresh air at any period of time a day. About the only people who were getting fresh air were people who were actually smokers, and they would go out and get outside and smoke their cigarettes and maybe get a little bit of fresh air, but also, of course, they were getting the carbon monoxide and carbon monoxide from the smoke. What we looked at is these 5 locations on the south side of the building, which faced towards the sun, and in Ottawa, where I'm stationed, the sun would be relatively low on the horizon. So you were getting very, very high levels of sunlight coming into this area. People were then tightening down the windows by putting down shades. They were moving away from the windows themselves, and they were getting concentrated in certain areas of the building. So we looked at what the pattern was in terms of the workers, and we figured out exactly what we needed to do in order to correct the problem, and that was to increase airflow in this area and monitoring of the carbon dioxide levels to make sure that you're getting more typical levels in that area. We took a look at where were the complaints. We looked at the complaints sheet, and we did a visual inspection of the area that were majority of the complaints. And we found 4 locations where, when we did measurements, we were seeing elevated volatile organic compounds. Why was that? Basically, there was a lot of personal hygiene products, perfume, the deodorants, things of that nature, but also there were indoor plants where the individual or either the individual themselves or the people who were asked to service the indoor plants were using a fair amount of chemicals to enhance the growing of the plants. And then there were cleaning products. There were, again, like I said, they had increased the amount of cleaning that they were doing in this building and using additional products to reduce what they thought would be the complaints about bad air. But by doing that, they elevated the volatile organic compounds that were being emitted in this area. And without too much changes in ventilation, they were getting high levels, particularly in the mornings, in this area. So in these 4 areas. So again, there were no specific health concerns, but the odors were definitely noticeable and they were irritating. So we did need to change some of the ventilation in that area. In some cases, we talked to the maintenance folks about the indoor plants, determine what chemicals they were using. Perhaps we did convince them to use other types of products that were less odorous. And then cleaning products, we were looking to get some clean or green cleaning products that were, again, less odorous and less likely to emit volatile organic compounds. So that was a typical indoor air quality problem that we ran into. But as you can see, it's not necessarily all about the sampling. It's also basically looking at the records, determining what type of use of products you're using there, and may not necessarily lead to occupational disease, but you're certainly going to have a number of complaints about people. And that's where indoor air quality has been working in with these building owners and building occupants for the last 40 years. So now let's look at a typical or another type of exposure, another type of problem, indoor environmental quality problem. This is another office building in downtown Ottawa, where I am working at the moment, and it's a new building, a brand new building actually. That has just been built in the last 5 years. And one of the features that they wanted to have in the building was a sunroof in the office building on the upper level. That's fine. It works reasonably well to bring in more sunlight, which most of us are in favor of. Obviously, it helps to make the building less of a problem from the viewpoint of stagnant air and things of that nature. And also, it does provide an aesthetic value to be able to look out the window and look out through the ceiling. The problem was they were getting elevated temperatures. Again, this window was facing towards the south, which is where you want it to be, because basically that's where you're going to have the most sunlight from the again, like I said, the sun tends to be low in the horizon in the wintertime, and it does get higher obviously in the summertime, but all the time the roof or the sunroof is getting a fair amount of heat coming in through that window. So what did they do? Well, there was proposed that they get shades, polyvinyl chloride shades, placed near their sunroof to block the sun during the summer in particular, but also in the winter as well. And they put up a very nice screen or shade that would block the sun at specific times of the day to prevent too much elevation of temperatures. So now, once they put this in place, they got new complaints about a chemical odor. Well, of course, people thought, well, where could the chemicals be coming from? Let's point out what's new, which is the polyvinyl chloride shades. They called in the installer and also the manufacturer to come and look at this issue. Once they've had a look at it and also looked at their data in terms of this type of material, that it couldn't be their shades. And why is that? Well, they said the reason was because the shades themselves, being made out of polyvinyl chloride, did not emit any type of odorant or any type of chemical unless the temperature was above 140 degrees Celsius. And of course, that's not what it was. When you measured the temperature down at the level where the occupants are, the levels were considerably lower than that. But there was continuing complaints about chemical odors. And so the building owner called us in and asked us what we thought about this. As you can see, in most cases, you do typical indoor air quality sampling. Again, you know, the carbon dioxide, even volatile organic compounds in this particular case, you still had no adverse results. At what level? Well, at the level in which the occupants, were located. So when we came in, we said, well, that's great, but that's not really where the problem may be. The problem probably is that you have to look at the PVC blinds themselves. Look at what type of temperatures might be at the window level, not necessarily down where the employees are, but basically where the windows are. And sure enough, when we got ourselves a nice ladder and got up there by the shades and took the temperature near the window, the combination of the window and the shades got temperatures that were elevated above 140 degrees C. The result of that was an off-gassing and the odor. And the manufacturer, said, well, okay, but that's not what this was planned for. Well, unfortunately, that's how it's being used. And that's what you got in terms of this is elevated off-gassing and odors in that area. This is not an inexpensive proposition. They spent about $120,000 Canadian to get these shades. Well, they had to replace them in order to reduce the amount of volatile organics that they were going to be emitting. And so this is looking beyond just the indoor air quality sampling. This is looking at indoor environmental quality. In this case, how the temperatures may be affecting something like these shades. And that's really where I see our field growing in the future, is more into that area of expertise, looking beyond indoor air quality. So the last one I'm going to give is something relatively new. Actually, right now, reopening a small college in the COVID-19 age. Many places, this college closed in March of 2020 due to COVID-19, and it's planning to reopen this month. There's been a thorough cleaning of all the areas, disinfecting of select areas such as washrooms and labs, limited access, and temperature checks. All the typical things that you would expect, and what you would hope would basically eliminate or potentially eliminate any problems with regards to COVID-19. But you notice that what I have not included on here is any type of air sampling of any sort. Why is that? Well, the main reason is that because viruses are not effectively measured by air sampling at this point. You can get them on surfaces, and that's why you're doing the thorough cleaning. But really, in most cases, you don't know what the levels are in the building. Now, the biggest problem with that, of course, is even though you have limited access, by doing the temperatures on the forehead of the individuals, you're hoping to eliminate people who are symptomatic. But there are, as many of us know, there are many people who are asymptomatic, who are basically exhibiting no symptoms of COVID-19, the disease at all, in terms of coughing or sneezing or running nose, or now the number of different types of symptoms that you can expect has been expanded to include problems with liver function, with stomach aches, with skeletal problems of that nature. You do have to be real careful in allowing people back in, and you can't just rely on the temperature checks because they may not necessarily have an elevated temperature, yet they may be, unfortunately, a spreader into your area. So you have to be real careful in terms of how you're reopening buildings. And there's been an ongoing discussion with a number of people, both here in Canada, in the United States, and worldwide, as to how do you go about opening, particularly colleges, universities, and schools coming up in the next couple of months. How do we approach these types of problems? Well, this is an interesting situation now. For most of my career, almost all of it, I've been focused in on the contaminants that are brought into the environment and measuring them and determining how much exists in that environment and how they're going to affect the occupants. Well, the problem is with COVID-19 and all infectious diseases that we're now dealing with something where the people that are coming into the building are potentially the problem. So we're really dealing with a very different approach from what we've been doing with regard to industrial hygiene, indoor air quality, and to some degree, even in indoor environmental quality, because now we're not just looking at what might be in these buildings, but what people are bringing into these buildings. And that is a different approach completely. So the only thing we can really do, really in terms of that, and other than not have people come into buildings, which is obviously is not going to work, is we need to basically do a very thorough investigative approach to all of the buildings, so that even if somebody comes in and is asymptomatic and basically is still spreading, that we are cleaning all the buildings as soon as possible, doing any type of elimination of problems from anybody who has come into the building. And we have to basically take into account that maybe other problems as well within the buildings when we start to reopen. But a thorough inspection of all rooms is necessary. I mean, when you look at it this way, it's not just the students, it's the teachers, it's the maintenance staff, contractors, it's the construction workers, it's the engineers, it's the industrial hygienists. Any one of them could be your spreader. It could be the individual who's coming into your building who may spread the virus. So you have to basically make sure that you're doing all of these types of measures, including cleaning stations at all microbial areas throughout the building, and inspection of the air handling units and other related ducts. We're seeing, as I said, that the airborne transmission is a potential problem from the viewpoint of this type of disease at this point. So we're going beyond just the immediate location where people are located. We're going into all the systems, and that includes the water system. The water system may not necessarily have COVID-19, but it does have other types of problems with regards to stagnation. And Legionella is one of those. So you have to make sure when you're going into a building that hasn't been open for the last 4 months, that you do a thorough flushing to make sure that that is all taken care of as well. But you're looking at all different types of systems that are coming in. And again, it depends on how open your buildings are. Have you looked at your loading dock? Have you looked at how they're picking up trash? Who's doing that? Overnight workers, how are they doing their cleaning? Who's checking their symptoms? Or do you have an individual that's doing temperature checks even on the individuals who are coming in overnight? What do you do with dormitories? How do you detect individuals there? Who's coming into the dormitories? How do we screen out visitors? There's a lot of steps, and all of it comes back to people. We're dealing with a whole new upside down world where we're not necessarily looking to protect people, but we're looking to detect people, to determine whether or not they actually have a potential problem. And that's really going to be a big change in the way in which we approach these problems. So this is a new approach in many ways. Here's some of the personal protective equipment, and then this is another way in which we've flipped the chart, as it were. For those of you who are industrial hygienists or indoor air quality specialists, generally speaking, you work from the top down, where in terms of controls. And the top control is engineering controls. And that's something we still have to pay more attention to than we have been up to now. But it's still not very easy, because basically you have major changes in ventilation systems if you're going to eliminate the potential of airborne transmission. And that involves different filtration. I hear that in California, they're talking about a minimum filtration of what is known as a MERV 13, which is a much higher level than what has been done before. MERV 8 was typical in these buildings, and now we're talking about MERV 13. For those of you who are not familiar with that, it just means in effect that you have a thicker, more dense type of filter that filters out more of the smaller particles. But you also then have, beyond the engineering controls, which you can put into effect, you have administrative controls, and that we are using to some extent. We are doing physical or social distancing from other people. And we also are attempting to rotate people in and out of facilities such as healthcare facilities. But it's not highly effective. Unfortunately, we still have individuals who become ill even under those circumstances. So now you're brought down to what is usually the last line of defense, and that's personal protective equipment. It's generally not something you recommend to begin with, but unfortunately in this particular situation, we have no choice because the other two really don't do an effective job. And that goes back to the fact that it is people who are carriers, people who are the problem in this particular situation. So you're not dealing with things you can do to engineer out people. You're not doing, and you can do some things with administrative, but not a great deal. So now you're left with personal protective equipment. And in the healthcare facilities, I think the minimum that everybody's recommending is the N95 respirator. That is obviously in short supply. N stands for NIOSH, approved. 95 means it's 95% effective. It's a decent compromise, I guess would be the best way of putting it. It's not 100% effective, as the 95 designates, but it is something that most people in hospitals and healthcare facilities are using. 2 days ago, I was in a dentist having some surgery, and yes, this is what they used, as well as a number of other types of masks as well. So there are many people who are using what is known as non-medical mask face coverings in public spaces. Here in Ontario, we just went to all individuals who are in public spaces must wear a face mask of some sort, a face covering. And you see a typical one on the right-hand side here. These are, the best way to put it is these are not as effective as N95 respirators. It depends on how you use them and how well you're dealing with them. The advantages of the use of these non-medical masks and face coverings is, generally speaking, they're made out of fabrics that are washable, so you can reuse them. Whereas the N95s, there have been some progress in terms of decontaminating them, but they're still not cleaning oriented. Whereas the non-medical mask and face coverings are more oriented towards that type of reuse. And you can see that I listed a homemade face mask. Many people are doing that now. They can be washable and then easily replaceable by other types of masks. The best advice I've seen on these masks has been from CDC that talks about having the different type of layers of materials. I think that's unfortunately where we're going to be for quite some time. Also, if you haven't seen them, there are a number of good videos on YouTube and elsewhere which shows how you should wear these masks. If you have somebody who's not very familiar with wearing these types of masks, it would always good to refer them to that particular, to the number of different YouTube videos that are out there. Not the best of situations, but it's the one we have right now, and we'll have to live with this for whatever length of time it is before we have a vaccine. So these are the Singapore Ministry of Health restrictions, which most of you should be familiar with. One that struck out to me as being different was the 1 meter safe distancing. In the United States, they call it 6 feet. Here in Canada, we call it 2 meters. Most of these 1 meter, 2 meter, 6 feet safe distancing all go back to some studies that were done in the 1930s. These were guesses at the best from people who were studying infectious diseases at that point. And those have, now have survived for over 90 years, the way in which we take safe distancing or social distancing. Looking at a number of other types of videos that you've seen probably on YouTube and elsewhere, if you have someone who's sneezing in particular, but also anyone else who may be coughing, they may be spreading COVID-19 virus as much as 6 to, in some cases I've seen, 10 feet away from their mouth. So it is not necessarily true that 1, 2 or meters or 6 feet are necessarily safe in terms of distancing. But that's maybe potentially more of a healthcare facility situation, but it is still out there. And we've seen this already with a number of problems that people have had when they started to reopen, particularly in the United States, with regards to very tight and not well ventilated spaces, such as restaurants and bars and places like that, which have ended up being hotspots for this type of problem. Keep in mind that 1 meter is probably good if you're both wearing masks, but it's not good if one of you isn't and the other one is. And keep in mind that the masks that we're talking about are not 100% protective, so you have to be careful about that in terms of maintaining your distance. It's usually best to try to do as much distancing from each other as possible. So those are some of the Singapore regulations. Here's a book that I think some of you may or may not be familiar with. And this relates back to industrial ventilation in facilities that are not just industrial, but also commercial, malls, also schools, any type of retail facilities. This book here, which is in its 30th edition, is the best book available in terms of ventilation for industrial facilities. It's not intended for homes, it's not intended for residents, but it's intended for any other facility that you might encounter over your course of your career. And I would recommend that you either get a hard copy or get a PDF download from the ACGIH website. It's an excellent publication. And then many of you are already familiar with this one, ASHRAE's Ventilation for Acceptable Indoor Air Quality. Full disclosure, I'm involved in the Indoor Air Quality Guide that's under standard, and the newest one is out in 2019. They update this about every 3 years. It's also ANSI approved as well, and it's an excellent guide. It's been the guide for acceptable indoor air quality since 1973, and they have published a number of standards since then. So this is another publication you can download from the ASHRAE website and get some good information. Now, indoor environmental quality, you've heard me talk about it, but there's no book. There's no standard practice at this point. Within the IEQ, which I mentioned, the Global Alliance, there has been some discussion about this, and we're looking to potentially get a book out in maybe the next couple of years. We're looking for volunteers to help out. Anybody who has expertise in acoustics and lighting, air, anything in regards to ventilation, indoor air quality. We're looking for help with that, and certainly you can contact me and volunteer. We're always looking for volunteers in that regard. So my conclusions basically are as follows. This is a very different type of complex multidisciplinary subject that involves both health and comfort issues. For most of my career in this area, which I said was about 35, 40 years, I've worked with other types of professionals, particularly mechanical engineers, to deal with health and comfort issues and indoor air quality investigations, as well as IEQ investigations. And I find that also working with physicians is a good way to get good information as well. But you should have a team available to deal with the types of problems that may exist in a building, because it's not all going to be typical. In fact, most of them are not going to be typical. They're all going to be different in many ways. It's depending on what it is that's happening in the building. But the key to good indoor air quality and indoor environmental quality investigators is knowledge of the building's HVAC, heating, ventilation, air conditioning systems. And that can be knowledge of knowing a mechanical engineer and basically making sure that they're involved. Knowledge of air contaminants, determine what is it that you can potentially have in these buildings. And making sure that any type of sampling you're doing is geared towards those. So you're not just doing a broad beam type of approach, but you're actually specifically getting down to where you may have some problems in an area. And good communication skills is really critical. What that means is that you need to have the ability to not only answer questions, but also to ask questions. In cases, the building maintenance people know more about the systems than anybody else in the building. And it's always good to ask them questions about what's going on. And they probably will be able to tell you more about what's the problem is than anybody else that's in the building. So good communication skills is critical. So I'll leave it open to questions at this point, and I'll turn it back over to Mitesh.
Feel free to ask Don any questions. We have about 2 minutes. So you can participate and ask your questions, please.
Hi, this is Travis Steinmetz. I appreciate your presentation. I have one question regarding your thoughts on increasing ventilation in commercial buildings with regards to reducing the risk of COVID transmission. when people start to reoccupy. One of the things I'm seeing is, in Maryland, that's causing issues with elevated indoor relative humidity levels because there's so much outside air. Do you have any thoughts on sort of the risk balance?
Yeah, and you're absolutely right. It is a risk balance in that regard. There is a lot of concern about increasing the amount of outdoor air coming into buildings because of the problems you mentioned, temperature discomfort as well as relative humidity increase. The key may be more going back and figuring out how do you go about the recycled air that you have, as well as the new fresh air from outside, using, as we talked about, maybe an MERV 13 type of filter, but also looking at some of the new technology with ultraviolet, the UV GI type of devices that are out there that you can put into your ventilation system that may reduce the potential for transmission of COVID-19, but at the same regard, allow that you can regulate the air temperature and humidity on that basis. So it's not necessarily true that just increasing ventilation is going to make a big difference. It's going to be whether or not you can also screen the ventilation by doing type of filtration that we talked about, and also maybe some other type of devices like UV, GI, things like that.
Okay, thank you.
You're welcome.
Any more questions or any feedbacks from anyone?
Hey, Don, it's Derek Dene. How are you, sir?
Hi, Derek. I knew you were out there.
Always a pleasure to see you. Mitesh, a pleasure to see you. We're doing a lot of COVID-19 related work here locally, especially in vulnerable populations. So our skill set, your skill set, all of our skill sets are in high demand right now. Very important. I did have a question about one of your case studies, though. You mentioned your vinyl PVC shades were getting up to 140 degrees Celsius, which is 284 degrees Fahrenheit. Did you mean 140 degrees Fahrenheit, which is 60 degrees
you're right.
Celsius?
You're right. That was my mistake. I'll correct that. You're right. But it's still, believe it or not, it was much hotter than it was down below. I'll correct that slide. Thank you, Derek.
I can absolutely believe it.
Yeah,
I'm in Phoenix, and it's I think it's going to be 140 degrees Fahrenheit today. No, not quite, but anyway, well, great to see you. Nice job to you and to Mitesh. Thank you, IEQA.
Thank you, Derek. So if anybody else have a quick thoughts on any part of the presentation? Okay, so if not all, then we'll close the presentation. So thanks everyone. Please send us an email and we'll address the questions accordingly. In addition, you can visit our Facebook and Telegram for update on upcoming programs and more information. I would like to close our today's session with a quote from Fred Rogers. Often when you think you are at the end of something, you are at the beginning of something else. Thanks, Don, for your presentation. And thanks everyone for attending this session. Good night from Singapore.